Hey everybody, this is Dr. Jay Greenstein coming to you live from Gaithersburg, Maryland. I'm here with the awesome Dr. Sheikh, a pain management specialist, PM&R, right?
Yes, that's
and Kristin, Petronio, who is the PA here in the practice. So thank you guys so much for giving us time today. I definitely want them to know about you. We've been co-treating patients together for many years. You guys do an amazing job. All of our patients have been super happy with the care and the service delivered. So we just want our tribe to know more about you and what you do. So Doc, tell us how, or tell the audience, how you got into this field.
Sure. First, I just want to say thank you for the opportunity. I always like chatting with folks that are like-minded in terms of pain management care. So a lot of different reasons that I chose a specialty. Probably the most important is it's a very tangible field to me. I think physicians really are trying to improve patients' lives in many different ways, but in a pain management office, you get to see the effect of your assessment, your treatment. The patient comes in, is not feeling well, and something that you do or say or prescribe makes them feel better, and you can see that. So I just love that cause and effect relationship.
I think it's really important to note, like you said, what we say, and what we say really matters, because our communication with our patient shows, first of all, empathy, but also at the same time gives them confidence and actually can help to improve outcomes. There's really strong literature around that, so it's great that you said that. And what about you, Kristin? Why did you get into this field?
I think for me, a lot of, I echo what Dr. Sheikh said, and I think a big part of what makes pain management so unique is the impact you can have on a patient's quality of life. And I just love to see a patient coming in, not able to do something that they enjoy or something that they really would love to get back to, whether it's something with their family or friends or a career, and being able to help them to that end point of really getting back to their quality of life is really rewarding for us.
Yeah, it's great to see a patient who comes in and they can't walk, and they leave and they feel significantly better, and it's not just like what the pain, not just the pain they're coming to us for, but it's what the pain prevents them from doing in their lives.
Exactly. Yeah.
So what are the most common conditions that you guys typically see?
So we see a broad range of conditions here. So we focus a lot on musculoskeletal conditions, whether it's a shoulder pain, knee pain, different kinds of bursitis or arthritises. We also treat spine, so neck pain, low back pain, and a lot of different pains within that as well.
Great. So when it comes to co-managing patients, we live in an era now of value-based healthcare, and care coordination is really, really important. What do you guys find most valuable in working with other healthcare providers to improve outcomes for patients?
Probably two things. I think communication between providers is key, and just patient education, meaning like we don't just tell a patient, here's your script for chiropractic, here's your script for physical therapy. We explain why it's part of their treatment plan in conjunction with other treatments. So
that's great.
I think we find that it increases adherence to the treatment. Right?
Great.
They actually want to do the program versus someone saying, "I'll go do PT for 6 weeks." Well, we'll see. There's no real vested interest in it. So I think we combine that and we show that we're willing to communicate with providers and we're all on the same page. The patient sees that, and it's just a better outcome for all of us.
Yeah, for sure. And it's great. Like we were talking earlier before we started this conversation, and we have a patient that we're co-managing, and I'm going to text Dr. Ingrassi and tell him what a great result we got, and it's like that's perfect. And patients need to understand that when you choose the right providers, they're having lots of conversations to ensure the best possible outcome. So that's why it's great to work with you guys. We live in the world of an opioid crisis. And I'm just wondering, from your perspective, Doc, what advice would you give to anybody out there, whether it's our tribe or anyone in the world, because obviously this is going to be on the web. What advice would you give someone who either has acute or chronic pain, and how to stay away from those really dangerous drugs?
Right. That is a hot topic.
Yes, it is.
For sure. There's such a large media swell around the opioid epidemic, and rightfully so. I just tell my patients, I think Kristin does the same thing, that the important part of the plan is learning what the condition is, why they're in pain, and why it's important to treat the root cause of it versus symptoms. And we never sort of admonish anyone for taking opioids. that is using them appropriately. There is an appropriate
Absolutely.
way to take opioids, but what I hate to see is treatment of with opioids for symptomatic relief without treatment of the underlying cause. That's not pain management.
Sure.
I mean, that's the biggest pet peeve of mine when people say pain management is where's my next prescription. No,
Yeah.
pain management is figuring out what the cause is, so you don't need to be on another medicine.
Yeah.
That's a huge difference from us and other places.
That's great feedback,
Yeah.
and we know as healthcare providers, the causes could be functional, they could be biomechanical, they could be psychosocial. There could be many reasons why these patients are suffering. Neurological. There could be many reasons why they're suffering in pain, and that's why it's great to work with providers like you guys, because you take a comprehensive approach to your patients' conditions. So lastly, what about any new and exciting innovations that are happening in the field today of pain management?
Sure. I think there's two that I'm excited about. Maybe, Kristin, you can regenerative medicine and spinal cord stimulation. So spinal cord stimulation has been around for a long time. It's actually implantable devices that go into the spine that help patients who are sort of past the conservative level of care, but are not interested in like more invasive surgeries. We do those now, but I like it because there's more and more conditions that it treats like every year, and the technology just gets better and better. The other side of it is regenerative. I don't know if you want to talk about that.
Yeah, regenerative medicine I think is really on the upswing in popularity now. I think the focus for years has been, for different kinds of arthritic conditions or degenerative conditions, how do we treat the inflammation and thus the pain? But the focus has kind of been shifting recently to how do we actually heal the tissue, and as a result of that, improve pain and outcomes. And I think that's going to be a real focus moving forward of, reducing the focus on symptomatic relief and really trying to improve really the root cause. Again, it comes back to that same idea, but I think that'll be a lot of the future of medicine in the musculoskeletal realm, of really the regenerative side of things.
Yeah, I think you guys are on target. We just actually completed a randomized controlled clinical trial in Pittsburgh on the impact of stem cells on the osteoarthritic knee. And while I can't share the results with you yet, I know the results, I can't share them with you. We'll be publishing that later this year. So
we're not quite there yet, but we're moving in that direction. We have an ultrasound machine that we acquired like 2 years ago. We started using it for like diagnostic purposes and image guidance, but it's the next segue into regenerative care. That's pretty much all ultrasound based.
Yeah, that's great.
So once we can get some traction behind it, we're going to include that in our practice, hopefully in the next year or two.
Okay, well, I ruptured my Achilles a couple years ago, and I got surgery from a great surgeon, Jim Gasho. He's awesome. But I feel like a little bit of a boost of either PRP or stem cells could be really beneficial. So you let me know when you got your
Don't wait for us. But
All right, well, thank you guys so much for being with me today. This is a lot of fun. Folks, come check these guys out. Phenomenal providers. And thanks so much. Have a great weekend.
Yeah, thank you. Thanks for having us.
Bye.
Thank you.